All right, folks, here we go. Let's learn about CBD. Let's figure out, really, is this all just a hoax, or is this something healthy for us? Before we begin, remember that any item is considered a drug and is subject to the FDA's approval process if it's intended for use in the diagnosis, cure, mitigation, treatment, or prevention of disease. So what's happening is all these CBD oil companies are coming out and they're making claims. But you see, only the products that have been FDA approved can make medical claims. And then again, they have to be consistent with FDA approved labeling. So we're getting into a little bit of trouble with our CBD oil because it's the Wild West out there, folks. This plant, the cannabis plant, is indigenous to both Central and South Asia, but it's been used for thousands of years to make things like hemp fiber or rope, clothing. They've used it to make bowstring, livestock feed, paper. It's been used for recreation, of course. It's been used in medicine and for religious ceremonies. They've made construction materials out of it, paper textiles, cordage, and also they use the edible seeds for hemp milk and hemp oil. So in contrast, we'll talk about THC, but CBD is not the rewarding part of the cannabis plant. THC, on the other hand, the delta 9 tetrahydrocannabinol is the prominent psychoactive component of marijuana. CBD, which we're going to talk about, is not rewarding, and it really has low concerns about an overdose. It doesn't induce severe adverse effects, and it really has a very strong safety profile, which makes it suitable for use in children when it's without THC. Because THC certainly is not a suitable treatment option. Now, the CBD was first isolated in 1940 from hemp grown in Minnesota. In 1974, the research showed that simultaneous exposure to CBD blocks that THC induced effects. So in other words, people smoke marijuana and they get this CD and they get this elevated pulse rate and lower time production tasks, and they have these psychological reactions, some people, to marijuana, such as anxiety or panic. But what they found is when you administer both CBD and THC at the same time, the CBD blocks those effects. It's capable of reducing those induced effects. And when they, in some research, when they administered the CBD 30 minutes prior, it didn't have the same effects. So when nature created this plant, nature put the proper amount of CBD and THC in this plant. But unfortunately, as you'll see as our lecture continues, breeders have made high content THC and have literally removed most of the CBD. Now, some of the history here you can see on the slide, talking about in 12,000 BC, again, they were using it for textiles, and in 2700 BC, they were using it for all kinds of things in China. Around 1800 BC, it was used in the Middle East, specifically for convulsions that were occurring at night. In 1500 BC, Ayurvedic medicine started using it for cases of anxiety. And in 1400 BC, it had a prominent position in both Sanskrit as well as Hindu literature. In fact, in medieval times, Islamic physicians used cannabis to treat nausea, vomiting, epilepsy, inflammation, pain, and fever. In the 17th century, King James ordered the landowners to grow industrial use marijuana for export purposes. Now, cannabis was used in the 1800s, well before aspirin. It was the most common analgesic drug. And an individual by the name of Ezra T. Hazeltine, who lived in Northwest Pennsylvania, made medicines in 1864, and it was called Piso's Cure. By the mid to late 19th century, Piso's Cure was widely used for pain, for muscle spasms, nausea, headache, and colds, and it was labeled for young and old. By 1899, cannabis was listed in the first edition of Merck's manual for the use of epilepsy. Folks, this is over 100 years ago they were using it for epilepsy. In 1930, the government attempted to associate cannabis with psychosis, mental deterioration, addiction, and violent crimes. In fact, they created the movie in 1936, a movie called Reefer Madness, to dissuade the American public from using cannabis. Now, historians have found that Andrew Mellon and the DuPont family were heavily investing in an industry that was competing with hemp. What they were doing is they were producing synthetic fibers such as nylon, and they wanted to reduce the growth of hemp. So, in 1937, our government enacted the Cannabis Tax Act. And as you can see, it required a stamp that was heavily taxed. Now, note what it says. The American Medical Association opposed this action. So, while this illicit use continued, dealers would not buy the stamp and pay the tax because it would incriminate them. In 1969, the Marijuana Tax Act was ruled unconstitutional, and by 1970, Congress passed legislation making marijuana a Schedule I drug, which we'll get to in a bit. The University of Mississippi School of Pharmacy at the time was the nation's only legal marijuana farm, and in 1996, California was the first state to allow marijuana for medical use, and soon thereafter, of course, many states followed, and Colorado was second, and Washington then was third. So there are different species of cannabis. There's cannabis sativa, there's cannabis indica, and cannabis ruderalis. Now, all of these species have different effects, and it's most likely due to the different concentrations of those main components in the plant. Only the leaves and the buds of the female sativa and indica plants have the psychoactive properties. The male plants do not contain THC, so they are not psychoactive. Among the 18 chemical classes, cannabis has about 565 compounds, 130 which are unique to just cannabinoids. So again, CBD is the second major component, THC is the first, in the marijuana plant. So here you're seeing major phytocannabinoids that are isolated from the cannabis plant, and they're showing, we'll be talking about actually some of the potential pharmaceutical uses for these. This plant is really attracting scientific interests. Now, while they were researching the effects of cannabis on the human brain, they discovered a new body system. Of course, we're all familiar with our reproductive system or our our skeletal system or digestive system or intestinal system. We now have a new system, folks, and it's called the endocannabinoid system. And humans, like all mammals, produce endogenous cannabinoids. So, of course, they're called endocannabinoids because it's endo for internal. Now, these cannabinoids that we produce are similar to the cannabinoids found in herbal cannabis. So endocannabinoids are involved in many different things in our body: temperature control, pain modulation, appetite, nausea, cellular migration, controlling inflammation, and so many other things. So to date, 2 cannabinoid receptor sites have been identified in animals and human tissue. The CB1 receptors are primarily found in the peripheral nervous system as well as the digestive and respiratory tracts. Now, using laboratory mice, it's been suggested that the CB1 receptor also plays a role in depression, anxiety, feeding, and cognition. These, I don't know how in depth I should go. This lecture might be a lot longer than the others, but I think it's information that you should know. But these CB1 receptors inhibit the release of acetylcholine, noradrenaline, GABA, glutamate, serotonin, and dopamine. Inhibit the release of those. The CBD2, these receptor sites are mostly prominent in the immune system. Of course, they're in other areas as well. But the data is demonstrating that these CB2 receptors are also expressed in the microglia, which is, of course, our first and main form of active immune defense in our brain and spinal cord. So as you can see, there are important attributes to this CBD oil, which again is why it has attracted so much interest with researchers and scientists. In fact, there are over 25 conditions that are currently under investigation regarding the therapeutic effects of CBD. And several of these studies have administered oral doses of up to 600 milligrams a day to healthy participants, and there have been no or minimal side effects. Now, the research, of course, falls under multiple agencies, including the Drug Enforcement Agency, the Department of Health and Human Services, the Food and Drug Administration, the National Institute of Drug Abuse. But folks, clinical trials are being conducted not just here in the United States, but pretty much around the world, including Canada, Israel, and the Netherlands. CBD, as I mentioned before, has low concerns about an overdose, and it does not induce severe side effects. Now, again, this is CBD, not the THC. Currently, we have over 153 studies that are being done on CBD for anxiety, bipolar, epilepsy, alcoholism, and post-traumatic stress syndrome. So I want to take a moment and just show you some of the research that's being done. In 1981, CBD was tested as an anticonvulsant in Brazil. It was a very small study. There were only 15 patients, but they were treated with either CBD or a placebo in a double-blind fashion study. Half of the people had complete seizure control with simply 200 milligrams a day, while one of the people in that study, of course, had to have 300 milligrams a day. But remember, a double-blind fashion research project, that means it's neither the subjects nor the researchers know who are in the test group and who are in the control group. So it's really one of the best ways to test this kind of stuff. Now, pain adversely, of course, affects a large portion of our population, especially cancer patients. We've got over 10 million people that are diagnosed with cancer each year worldwide, and it's estimated that 15 million people will be diagnosed annually beginning this year in 2020. So there's a tremendous opportunity for people to have something like CBD that can help them with the pain while they're undergoing their cancer treatments. Because CBD targets cell migration and invasion. It stimulates cancer cell death. It's chemoprotective, and it can inhibit both estrogen receptive positive and estrogen receptive negative human breast cancer cell lines. Regarding schizophrenia, reduced psychotic symptoms similar to the prescription drug amilcaride, but patients had significantly less side effects using the CBD. We're looking at Parkinson's here. Significant improvements in patients with just 300 milligrams per day. Remember, we talked about cognitive functioning and CBD? This is one of the ways that it can help with Parkinson's. Now, cannabis was used a century ago in the treatment of diarrhea, and currently it's been used in studies for inflammatory bowel diseases. It was used, remember, centuries ago as an analgesic, which is also on par with an anti-inflammatory remedy. So we're talking about ulcerative colitis, Crohn's disease, ileitis, gastric ulcers, secondary diarrhea, paralytic ileus, IBS, colon cancer, GERD, all kinds of inflammatory bowel problems. And in this particular study, placebo-treated smokers showed no difference in the number of cigarettes smoked, yet the CBD group significantly reduced the number of cigarettes by 40%. So this is just amazing. It really is hard to believe that something so prominent in nature can help with our body without using the THC portion of that. Now, anxiety disorders are very well known to be poorly controlled by current pharmaceutical options, and that only about 30% of the patients actually achieve remission. And yet, by using CBD, research shows that it can significantly reduce anxiety when compared to the placebo. About 160 milligrams a day of CBD significantly increased the quality of sleep, and these study volunteers spent more time asleep on top of it. Other studies have used 300 milligrams a day for 6 weeks. There's just no real standard amount of how much they've used in research, as you'll see when we get to the end. MS, there are about over 20 different anti-seizure drugs that exist. Some of the side effects from opioids and antidepressants comprise the quality of life in MS patients. I have a very good friend that takes these medications for her MS, and it's just debilitating for her. CBD would be something that she would be very willing to try. Some of the side effects of these drugs for MS include addiction, dizziness, sedation, nausea, vomiting, constipation, respiratory disorders, sleep disturbances, drowsiness, that hangover effect that people feel at times, fatigue, blurred vision, anxiety. I mean, the list really goes on. We've got about 2.5 million people that have been diagnosed in the U.S. with opioid use disorder. About 80 people die every day from opioid overdose, and about 200 million opioid painkiller prescriptions are written every year. States with legalized marijuana laws have reported a reduction in opioid use, and that there is evidence that CBD reduces that cue-induced drug-seeking behavior for up to 2 weeks following administration. And so therefore it suggests that there is a long-term impact relevant to those that have drug relapse. Alzheimer's, of course, is a debilitating neurodegenerative disease characterized by cognitive decline. Recall that ancient use for absent-mindedness from 2700 BC. Interesting, isn't it? Of course, we talked about pain a bit. It affects about 5% of the world population outside of cancer treatment patients. Less than 1/2 show complete and sustained remission of the symptoms after long-term treatments with pharmaceutical drugs. And although cannabis abuse is linked to anxiety and panic attacks, CBD, excuse me, CBD has the opposite effect, and it's very calming to the amygdala. The amygdala is that emotional part of our brains where most of that anxiety and depression originates. With low water solubility, one needs to consume their supplemental CBD with fat. The bioavailability from oral delivery has been estimated at only 6% due to a significant first-pass metabolism in the liver. So researchers, again, are just using exorbitant amounts, up to about 1,500 milligrams a day. I don't know how they afford that, but up to 1,500 milligrams a day is well tolerated in average individuals. It doesn't change the heart rate. It doesn't change the blood pressure or the body temperature. Interesting to note is that the plasma levels of oral CBD peak at 1 to 2 hours after taking it. So you're going to see that, again, the dosages have been all over the place. It's suggested, though, if someone wants to calculate a dose that one would start with, and I would titrate up, I certainly wouldn't start with this all at once, would be to consume about, let's see, how will I do this? 10 times your body weight in kilograms. So remember, we take our body weight, we divide it by 2.2, and that gives us how many kilograms we weigh. And then you multiply that by 10 milligrams. So if somebody weighs 150 pounds, we divide that by 2.2, they weigh 68 kilograms times 10 milligrams gives a dosage of 680 milligrams per day. Again, I would certainly titrate up to that, and that is still a very, very large amount. And titrating up will allow someone to see what kind of effect it has, because they may not need 680 milligrams every day. Remember, this is the Wild West when it comes to this particular supplement. Now, again, our therapeutic ranges are all over the place, but CBD is individual specific. We have to find the dose that works, start at what I call the therapeutic dose, which is 75 or 25 to 75 per day, and then try reducing the amount once the relief is experienced. Now, CBD does not halt pregnancy, it does not produce birth defects, it does not produce changes or damage to the genetic material, but there are some folks that it can interfere, CBD can interfere with, by inactivating CYP450. These groups of enzymes actually change many drugs, including anti-cancer drugs, into less toxic forms that are easier for the body to excrete. So it may interfere with that. And here, from Natural Medicine's comprehensive database, herbs and supplements with sedative properties, and anyone on a central nervous system depressant, like an antidepressant drug, all of these could also create adverse effects, because CBD has such a calming effect that when you add in these calming herbs or these calming pharmaceuticals, it could be too much. Let's talk a little bit about THC. THC in itself can cause memory impairment due to its effect on the brain, but remember that CBD attenuates this due to its pro-cognitive effects. As I mentioned before, these breeders of medicinal CBD have created these strains of marijuana plants that have high levels of THC and very low levels of CBD. If they're creating medicinal CBD, then they do the opposite. They create strains of marijuana plants that have high levels of CBD and very low, and even next to zero, levels of THC. So it all depends on what we need it for, right? The American Academy of Neurology published its guidelines in 2014 recommending oral cannabis extracts need to contain CBD. All right, 1974 research showed that simultaneous exposure to CBD blocks those THC-induced effects, as we mentioned before. So really, people that want to get high, folks, they don't want CBD in their marijuana. People that are using it medicinally want it exactly the opposite way. They want as much CBD and little to no THC, and that's just kind of how it works. So here are the plants that we talked about. Each of these species have different effects, most likely due, again, to their different concentrations of the main components. And as I mentioned before, the male plants don't contain THC, and they do not have psychoactive properties. Now, I am going on 68 years old. I was around in the 70s. I did inhale. And I remember there were times when people would say, well, this certainly isn't a very good plant because, you know, we're just getting sleepy from it. Now I know that it was probably either a male plant or it had high concentration of CBD. Not that I was a complete pothead or anything, but I'm very honest when I say, when people say, well, did you inhale? Yes, I did. So you may respect me less, but that was a whole lot of years ago, folks. Now, let's talk about synthetic THC-based drugs that are already on the market. There's one called Nabilone, and they're using that for chemotherapy patients and people with sleep disorders. Dronabinol is also for those on chemotherapy and for the treatment of weight loss for people that have AIDS. And this is THC because THC, remember, it's going to make them feel better. They're going to get sorry to say, but a little bit of a buzz. And they're going to feel better. And they're also going to want to eat a little bit more. And so that's why it helps with the weight loss. It is made from, Nabilone is made from cannabis. But again, because it's THC, you can see a list of the side effects that can be caused by this drug. Dronabinol, same thing. Look at the different side effects. It's man-made cannabis, but it is nonetheless a synthetic THC-based drug. So this is kind of what people looked like in the 70s. They had the dry mouth, they had the red eyes, all of this stuff, clumsy, all of those things. So this is also known as Marinol, but here are still more of the side effects. So back in the 70s, I'll keep going back to that, but we're talking over almost 50 years ago when this was in my life. There were many people that had extreme fear or not really hallucinations, but paranoia when we were at these crazy parties. Dronabinol, again, remember its other name is Marinol. It has interactions with 82 different drugs, especially grapefruit and St. John's wort. So people that are on Marinol have to be really educated on this, and oftentimes they are not. Now they have, because they know the importance of having a smidgen of THC in a CBD-based pharmaceutical drug. It's called Sativex, and this is an oral mucosal spray, and you can see the ratio. 1 to 101 is the ratio. There is real cannabis in the drug, but it's a patented pharmaceutical product, and it's approved for MS outside of the U.S. in 28 different countries, including Austria, Canada, the Czech Republic, Denmark, France, Germany, Israel, Italy, Poland, Spain, Sweden, and the UK. I mean, wow, right? We also have some CBD-based pharmaceutical drugs, and many of them are in development and under investigation, but this particular one is called Epidiolex, and it's a liquid formulation of pure CBD, and this is what they are using on unresponsive childhood epilepsy, mostly through that, and then they're also using it for non-cancerous benign growths in the body. But this is something that the World Health Organization is an advocate for, I guess I could say. Now, this oral solution is, again, plant-derived cannabidiol. It's an anti-epileptic drug, and it's indicated for the treatment of seizures in patients 2 years of age and older. So again, there are going to be some side effects. Remember how CBD calms the body down. The THC excites it. CBD kind of calms it down. So here you can see the drowsiness effect, where THC increases your appetite. CBD reduces the appetite. So you can just kind of see that, yes, there are going to be some side effects. Okay, let's talk a little bit about legalization. We've got 180 million worldwide between the ages of 18 and 65 that have used marijuana at least once in their lifetime. The Global Burden of Disease study estimates that approximately 13 million people worldwide are dependent on cannabis, and that rates of consumption are increasing, especially among younger populations. Unfortunately, the legalization predicts that there are further increase used among the young, and in 2013, 7.5 children over the age of 12 reported using marijuana during the preceding month. Well, I'm certainly not a fan of that at all. The findings are confirming that drug-using communities and cannabis producers are breeding, here we mentioned this before, are breeding higher THC content. Now, these are the people that want to get high. They are breeding higher content THC. For medicinal purposes, they are breeding plants with higher CBD content. But what happens then is we've got emergency room visits that are increasing. And further, these emergency room visits involving marijuana are going to increase over time, corresponding to the increased potency of that drug. So the negative consequences in the young, it's brain and mental illness. Honestly, the research shows that no one should use THC, no one should be smoking marijuana until after the age of 18, and even then that's a little bit young. They're actually looking at age 20, 21 when there has been more brain development going on, because in these young people that are trying THC, there's an increased risk for developing schizophrenia, a twofold increase in the risk of psychotic illnesses in cannabis-using adults. There are memory deficits and brain volume reduction. They've shown that effects on school performance and lifetime achievement, of course, is down. They have decreased cognitive function. They have decreased executive function, decreased learning, memory, attention, and of course, amotivation syndrome, where they just don't want to do anything. The risk of motor vehicle accidents is increasing from drugged driving, not drunk driving, but drugged driving. And we're finding chronic inflammation of the lungs, especially on the vascular system. Edibles, of course, are increasingly used, and within 90 minutes tend to manifest the symptoms of this THC. So kids are getting into even the edibles, and that really worries me. I have grandchildren now of age. Again, negative consequences. These edibles are increasingly being used, with the effects, again, appearing quite quickly after consumption. Now, marijuana, by smoking it can contain some of the same chemical constituents as tobacco smoke, arsenic, benzene, cadmium, formaldehyde, lead, and then of course toxicants such as ammonia, carbon monoxide, hydrogen cyanide, and tar are also present in smoking marijuana. Smoking marijuana can also increase the inhaled tar because they're puffing so deeply. And then holding it in their lungs to get the effects of the high. So again, not a fan. The lifetime risk for users of marijuana users the lifetime risk for drug dependency in marijuana users is approximately 9%. But listen to this. The lifetime risk for nicotine is 67.5%. And the lifetime risk for alcohol dependency is 22.7. So it is far less, but again, still not a fan of this. Now, as with anything, it can affect the brain development in the unborn. It can result in possible delayed psychodevelopmental maturation and reductions in intellectual function and motivation. Cannabis should not be used by pregnant or lactating women, and especially to be careful with the risk-benefit analysis should be done in anybody under the age of 18. So the percentage of cannabinoids, again, as we mentioned before, vary depending on the cannabis strain, the climate, the soil, the techniques of cultivation. CBD oil in the supplement industry is made by a solvent extraction of CBD-rich female cannabis flowers, and they dissolve it in an oil. The male plants, as we mentioned before, produce much lower quantities of the cannabinoids, and pollinated females divert resources away from cannabinoid production for seed development. So again, the concerns that potency and product labeling of THC content, it varies widely among dispensaries, and a lot of patients are at risk for under and overdosing. The major concern is the labeling accuracy of these CBD products. Now, as you look at some of these statistics here, only 30% accurately labeled, under-labeled, almost 43%. Researchers found 26% less CBD. Some of the products had negligible or less than 1% of CBD. And here's the really important thing. THC was detected up to 6.43 milligrams per milliliter in 18 of 84 samples tested. That means people that are going to be drug tested at work are going to be in a heck of a lot of trouble if they get a poor quality CBD. The other problem is these plants may be sprayed with contaminants, such as other psychoactive drugs, to enhance the effects of poor quality or male marijuana plants, the extraction of CBD from hemp refuse may contain pesticides and agricultural toxins because hemp is considered a bioaccumulator. It absorbs heavy metals and other chemical waste from the soil. So as we mentioned, we need to have quality assurance. This particular lab, I believe it's in Massachusetts, Proverde Laboratory, they really do an excellent job in quality assurance testing. I looked at a lot of different labs to see what they were doing. And they were doing quite a bit. This is page 2 and 3 of one of their reports, so you can actually see. Now, they're also testing at some point, was it on this slide? Yes, on this slide, they were looking at the major phytocannabinoids that should be in a good CBD oil. Because remember, this good quality CBD oil can be antifungal, it can be antibacterial, it has the potential of inhibiting MRSA, it has cancer properties for the skin, the prostate, the breast, it has antidepressant qualities. It helps to lower blood pressure. It inhibits the growth of certain kind of skin cells that can contribute to psoriasis. It can promote muscle relaxation. It can block the uptake of GABA. It can lower the eye pressure in people with glaucoma. It can enhance the appetite. It's also neuroprotective. So my point is that if people are going to use CBD, they have to use a product that is being tested, that's real, that's got the right content of what there is being said on the label. Because again, there is a lot going on with this THC and CBD. Now, there are reports that people are saying that CBD can be converted into THC in humans, and so far there is no scientific evidence to back that up. But something everyone should know is that CBD can be part of a panel that tests for THC in those that have mandatory drug testing at work, or for those who are on parole. So we've got one particular test is called the Must Be Safe. It's a urine test, and they do it in the unions. And they do not only check for THC, they check for CBD. And even though CBD is not psychoactive, CBD in your urine, you drop dirty, as it's called. Now let's talk about the Schedule 1 drug. The criteria for a Schedule 1 drug is that there are no currently acceptable medical use, has a high potential for abuse, and it lacks safety. In the U.S., federal and state laws are in conflict about the legalization of CBD. Now you can see that both in Israel, England, Canada, and Spain, they've all been long on the bandwagon for approving CBD. But in the U.S., at the federal level, I'm not talking state level, but at the federal level, CBD is still considered a Schedule 1 substance. Schedule 1. That's mescaline, psilocybin mushrooms, peyote buttons, heroin, LSD. Oh my goodness, right? And this is the problem. Remember, a Schedule 2 is they currently have medical use of that particular substance. It's still a high potential for abuse, and it may lead to severe psychological or physical dependence. But Schedule 1 is, a Schedule 1 drug is the highest rating one can have. So heroin, LSD, right? Opioids are a Schedule 2. Morphine is a Schedule 2. So Schedule 3 drugs have a currently accepted medical use and a lower abuse potential. So again, they're still categorizing CBD as marijuana, and it's not. If it doesn't have the THC, it's not. because CBD is a derivative of marijuana. It's a component of marijuana. And this is true of all those other individual cannabinoids. So according to the Drug Enforcement Agency, CBD is still labeled at a federal level because it's a derivative of marijuana. This is a great link for you to go to for the medical marijuana pros and cons. It's really an interesting website, and you'll see both sides of the story there. Now, hemp is both legal and illegal still in Canada and Europe. They have specific hemp varieties that can be cultivated, but they cannot contain more than 2% THC content. And in Canada, it's no more than 3% THC content. But hemp, as we mentioned before, it's grown for the fiber, the seeds, and most people use it even as a health supplement. The plants, now this is what's interesting. The Controlled Substances Act doesn't define hemp. How am I trying to say this? If the plant has roots in the ground, it's defined as marijuana out of the Controlled Substances Act. So, because it grows in the ground, they can say that this is illegal as well. But obviously, people have been using hemp for rope and things like that for quite a long time. But this is something they could enforce if they decided to. But let's talk about kind of how this all began. Carly Chandler of Birmingham, Alabama, she had about 200 to 300 seizures every day, and by the age of 5, she still was not walking or talking. So her father showed lawmakers videos of his convulsing child and convinced them of the importance of access to CBD. So in 2014, Alabama actually passed Carly's law that authorized the use of CBD as part of a clinical study at the University of Alabama in Birmingham. So this little girl was instrumental, actually her father. Now this little girl is probably more famous, and her name is Charlotte Figi. Charlotte became a symbol of the possibilities of CBD after CNN chief medical correspondent Dr. Sanjay Gupta told her story in the documentary Weed. In the film, Charlotte was shown to be a playful child who became overcome with these horrific seizures, and yet they were quelled with a particular CBD oil that was named in her honor. It's called Charlotte's Web. So this particular medical act proposes to exclude industrial hemp and CBD from the definition of marijuana in the Controlled Substances Act, so patients can have legal access to it. So this little girl recently passed away just this month from pneumonia, but she had a much better life because her father was able to get this changed for her and give her access to CBD oil. Legalization has outpaced science for the first time in history. And for the first time in history, a plant has been decided upon at the ballot box. People are voting. 57% of adults support marijuana legalization. And look at how it's changed since 2006. Millennials are 71% more to favor legalization than a decade ago. People are beginning to understand how much promise this particular plant has. I just hope that we can keep the THC out of these young people. Medical marijuana is legal today in 29 states, the District of Columbia, Guam, and Puerto Rico. However, patients using medical marijuana are not protected from the discrimination under the American with Disabilities Act. So they cannot use it. They are not protected. A few little terms. Legalization means the removal of criminal penalties. The decriminalization removes both criminal and monetary penalties. Medicalization allows physicians to authorize access for obtaining. So this is where it's all going. We've got senators that are supporting CBD, not THC. Let's keep it straight. Chuck and Diane want to remove the barriers to scientific and medical evaluations of CBD. They're asking the Attorney General, Loretta Lynn, and Secretary Sylvia Burrell of the Department of Justice and Health and Human Services to do just that. Dr. Nora Volkow, she presented to the National Institute on Drug Abuse, stating that there is a lot of research out there supporting the potential therapeutic value of CBD, and many of these people are saying that it could be one of the answers to the opioid epidemic that we're all facing. So folks, there's a little bit, well, probably a lot of information on CBD and THC, and the slides that follow, I'll just go through them. These were some of the references that I used to create the presentation. I always do a lot of work when I'm presenting information to my students, and so hopefully you found this of interest, and we'll understand a little bit more why it's so important to have good testing done on these marijuana plants. Thanks for listening.